My name is Dr. Rodriguez. I am a weight loss doctor in weightrx.org. Did you know that semaglutide, a glucagon-like peptide 1, GLP-1, receptor agonist, has gained attention for its dual role in weight management and metabolic health improvement? One significant mechanism through which semaglutide exerts its benefits is the reduction of systemic inflammation, a common contributor to obesity-related complications. Below is an in-depth exploration of how semaglutide-induced weight loss helps reduce inflammation markers. Obesity is characterized by chronic low-grade inflammation, largely driven by adipose tissue dysfunction. Excess fat, particularly visceral adiposity, secretes pro-inflammatory cytokines such as tumor necrosis factor alpha, TNF-alpha, interleukin-6, IL-6, and C-reactive protein, CRP. These cytokines disrupt normal metabolic processes, contributing to insulin resistance, cardiovascular risk, and systemic inflammation. Semaglutide suppresses the activation of nuclear factor kappa B, NF-kappa B, a key transcription factor that drives the expression of inflammatory cytokines, shifting macrophage polarization. It promotes a shift from pro-inflammatory M1 macrophages to anti-inflammatory M2 macrophages within tissues, particularly in adipose tissue, reducing oxidative stress. By decreasing the generation of reactive oxygen species, ROS, semaglutide lowers inflammation at a cellular level. These mechanisms collectively contribute to the reduced levels of inflammatory markers such as TNF-alpha, IL-6, and CRP. Insulin resistance and chronic inflammation are closely linked in metabolic disorders. Elevated glucose levels and insulin resistance perpetuate a state of oxidative stress and inflammation. Semaglutide's ability to enhance insulin sensitivity and lower blood glucose plays a crucial role in breaking this cycle. Glycemic control. By improving glycemic control, semaglutide reduces glycation end products and their pro-inflammatory effects. Anti-inflammatory effects of insulin. Improved insulin sensitivity restores the hormone's natural anti-inflammatory properties, further decreasing inflammation markers. Emerging research highlights the role of gut microbiota in systemic inflammation. Dysbiosis, or an imbalance in gut bacteria, is common in obesity and promotes inflammation by increasing gut permeability and endotoxin release. Lipopolysaccharides, LPS. Semaglutide has been shown to influence gut microbiota composition indirectly through weight loss and dietary changes. A healthier microbiota composition reduces gut permeability and systemic LPS levels, thereby lowering inflammation markers. Chronic inflammation contributes to endothelial dysfunction and atherogenesis in obesity-related cardiovascular disease. Semaglutide's weight loss effects reduce vascular inflammation through lower CRP levels. CRP, a marker of systemic inflammation and cardiovascular risk, is significantly reduced with semaglutide treatment. Improved lipid profiles. Weight loss improves dyslipidemia, reducing LDL cholesterol and triglycerides, which are associated with vascular inflammation. Reduced arterial stiffness. Enhanced vascular health further lowers inflammation markers by mitigating endothelial stress. Non-alcoholic fatty liver disease, NAFLD, common in obesity, is closely linked to systemic inflammation. Weight loss induced by semaglutide improves hepatic fat content and reduces liver enzymes such as ALT and AST, which are markers of hepatic inflammation. The reduction in liver fat also leads to decreased secretion of inflammatory mediators from the liver. Weight loss facilitated by semaglutide enhances the secretion of adiponectin, an anti-inflammatory adipokine. Adiponectin counters the effects of pro-inflammatory cytokines, improving insulin sensitivity and vascular health. Elevated adiponectin levels correlate with lower systemic inflammation markers.
For more information on this topic, please subscribe to our channel or text our clinic number. Brought to you by weightrx.org.